My name's Magdalene. I'm one of the speech therapists at the Encompass Rehab Hospital. We're over on Appaloosa Trail by Rio Concho West, the retirement community over there. Our hospital's been open for about 4 years, and we are a stroke certified program, a stroke certified hospital. So what that means is that we have a rehab specific program for stroke patients. They usually come from the main hospital, Shannon, and they come to us for extended therapy and rehab. I'm the coordinator for that stroke program. And so part of our program is education for the community. And so that's why we're here today. And a lot of you come in and said, I hope I never need this. And I hope you don't either. But what we're talking about is preventing a stroke, and that is what everybody needs. So we'll talk about that, and then Taylor's going to talk about the hospital and what we can offer if you or a family member does end up having a stroke. Okay, so first we'll just talk about what stroke is. I don't know that it's working, Riley. Okay, so starting real basic, the brain is the central organ of our nervous system. The brain controls everything. The brain makes you breathe. The brain makes you blink. The brain makes you wave. The brain makes you walk. Everything that you can do, everything that you can feel, right? So when I tap my hand like this, there's nerves in my hand that get sent up to my brain, and my brain processes that information as, oh, my hand is being tapped. The brain is a very small organ comparatively to some other organs in the body, but it's the most complex organ in the body. There are billions of neurons, billions of brain cells that are firing all the time, doing everything. There are brain cells working when you're hearing that beeping that was happening and you're registering that you heard a beep. There are brain cells that are focused on what I'm saying. There are brain cells that are picking up information that you're sitting in a chair right now. The brain does so much. This says it reaches its maximum size by age 18, but it does not reach its full development until later, in the mid to late 20s. Later for men than for women. The brain, and that's a fact. The brain is constantly changing and adapting. There's something called neuroplasticity, where if there's some sort of damage to the brain is really good at figuring out a new way to complete whatever task or function is no longer working well. Okay, next slide. Okay, so then what is a stroke? A stroke, very simply, is any blockage or any way that blood is not reaching a certain part of the body, and that can happen in a couple different ways. You can see, you can see on that picture the arteries that run through the brain. Arteries bring blood, which have oxygen and nutrients, to the cells of the brain. When that blood is stopped from traveling to a certain part of the brain, then that part of the brain doesn't get nutrients, doesn't get oxygen, and then it can't work right. So anytime that there is like a blood clot or a brain bleed, that prevents the blood from flowing, and then that part of the brain is affected, and that's what a stroke is. And a stroke, and we'll talk more about this, a stroke is a medical emergency. The sooner that you get to a hospital to get treatment, the better. I had patients at the hospital who immediately feel that something's changed. They maybe think they're having a stroke. They get straight to the hospital, and we're able to do certain treatments to prevent the severity of the stroke. The quicker we can get to the hospital. I also have other patients who feel some symptoms, and they wait days before they go to the hospital. And then they're really impaired, and it's really hard to gain back function. So it is really important to get to a hospital quickly. Okay, next slide. You can kind of think of a stroke as a brain attack, similar to a heart attack. These are just some stroke facts. Stroke is more common, age 55 or older, but it can happen at any time. Children, babies, even babies in utero can even have strokes. Stroke is a leading cause of disability in the United States. Some people will make a full recovery, but most people who have a stroke still have some degree of symptoms of some deficits after the stroke. Every 40 seconds, someone in the United States has a stroke. That's a lot. That's a hard fact to read. And every minute during a stroke, 2 million brain cells die. So that speaks to how important it is to get to the hospital quickly. Okay, next slide. These are some more facts. There are more than 9 million stroke survivors in the United States. Every year, about 800,000 people have a stroke in our country, with about 185,000 being recurrent strokes. It's not their first stroke. Stroke is the 5th leading cause of death in the United States, the 3rd leading cause of death for women. More women than men have strokes in the United States. And then at the bottom there, up to 80% of strokes are preventable. That's huge. And that's what we're going to talk about today, because, like I said, I see patients all the time that come in with a stroke, and they were not taking steps to prevent a stroke from happening. So that's what we want to share today. Okay, next slide. There are 2 main types of stroke. An ischemic stroke is a stroke from a blood clot. 87% of strokes are from a blood clot. You can kind of see in the picture a piece of plaque, cholesterol, blocking that artery from that blood flowing to that part of the brain. Okay, next slide. The second type of stroke is a hemorrhagic stroke. This is a brain bleed or a brain aneurysm. These are much less common, but instead of a blood clotting, it's the blood vessel bursts, and that blood is not able to get where it's supposed to go. They are less common, but they are more associated with a higher risk of death, of mortality, after one of these occurs. Okay, next slide. A transient ischemic attack, or a TIA, is often called a mini stroke. You may present like you're having a stroke. You may have weakness on one side of the body, your speech might be slurred, but within 24 hours, those symptoms are gone. And so what happens during a TIA is there might be a little blood clot, so that blood is not able to flow to where it needs to in the brain, so something in the body's not working, but that blood clot disperses. It passes through, and blood is able to get to where it needs to go. They're called mini strokes, but we emphasize how important it is to not just kind of push it aside. It's like, oh, it was just a mini stroke. TIAs are usually a sign that a larger real stroke may be coming down the road. So these are important signs to look at. And make sure that you're following up with your doctor and getting any testing that needs to be done. We'll talk more about that too. Okay, next slide. These are some of the most common symptoms of a stroke. It's an acronym FAST. The F stands for face, so one side of the face might droop, might be weak. If you have someone smile and one side of their mouth does not come up. The A stands for arms. If the person raises up their arms, maybe they can't raise one arm because there's weakness on that one side of the body. The S stands for speech. That could be slurred speech. That could be words that don't make sense. That could be having difficulty understanding what someone is saying to that person. That is usually one of the first signs of a stroke, along with kind of the facial droop. And then the T stands for time, just how important it is to get to the hospital as soon as possible. Okay, next slide. These are some other signs of stroke. Numbness, usually on one side of the body that's been affected. Confusion. Difficulty seeing, blurry vision, or like a field cut. So maybe you can't see over here, but you can see over here. Trouble walking, balance might be affected, and then severe headache. Okay, next slide. This talks about how important it is to get to the hospital quickly. There is a clot-busting drug that we typically use with really great outcomes. It's called TPA. The thing with that drug is you have to have it administered within 4 hours of the stroke. If it's been longer than that, it's not going to be effective. They can't give it. I have a patient right now in the hospital, and she had a stroke last Tuesday, a week ago, and she went to the hospital immediately. They were able to give her the TPA, the clot-busting drug. Her symptoms went way, 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 way down. She was not able to speak. She was not able to move her leg. After that drug was given, her speech came back. She was able to move her leg. She still has some deficits, but it's so much less than what it would have been if they had not given her that medicine. And they could not have given her the medicine if she didn't get to the hospital quickly. Okay, next slide. So depending on where in the brain the stroke happens, depends on the symptoms that you have. You know, there are certain parts of the brain that focus more on like motor movement, being able to walk and stand. If you have a stroke in that part of the brain, that's going to be affected. There's a certain part of the brain that focuses more on speech. If your stroke is there, your speech is likely to be affected. And of course, the size of the stroke, there are small strokes and there are big strokes. Depending on how much of the brain is affected, the severity of the symptoms follows suit. Okay, next slide. You see this picture? I don't know how well you can see that. This is a body cut in half, and we're looking at the left side. So the left side of the brain controls the right side of the body. It's contralateral. The right side of the brain controls the left side of the body. And so the left side of the brain is more focused on things like spoken language, number skills, reasoning, scientific functions. It's the more analytical part of the brain. That's also where most of your speech centers lie, in the left hemisphere. Next slide. The right side of your brain is more creative. Things like music, spatial orientation, art, creativity, and insight are more centered on the right side of the brain. That doesn't mean that there's not some crossover. You know, there are definitely all of the brain is used in lots of different functions, but generally, this is what we see. Next slide. So, talking about prevention now. So there are certain risk factors that we cannot do anything about. Unfortunately, the older we get, the more at risk we are of having a stroke. We can't do anything about that. Having a family history of stroke or having a history of stroke yourself does make you at a higher risk of having another stroke. Can't do anything about those. Next slide. So we focus on the things we can manage to reduce our risk of stroke. Managing blood pressure is one of the biggest things that we can do to prevent stroke. And after the presentation, I'm going to hand out a flyer, a handout that has more information on that. A good blood pressure is 120/80. And it's a good idea to keep track of your blood pressures, keep a log every day, every week, so you can kind of see trends over time. You can say, hey, my blood pressure is starting to increase over these last 6 months. I'm going to talk to my doctor about that. Having diabetes also increases your risk of stroke. So having high blood sugars or blood sugars that vary, go high and then go low and then go high, that can affect the plaque in your arteries, and it can also affect the integrity of the artery walls, which can increase the risk of stroke. High cholesterol is another significant factor, and we'll talk more about that later too. Circulation problems and heart problems also increase your risk of stroke. So managing these medical conditions with your doctor by taking medications as prescribed is super, super important, and one of the biggest ways that you can prevent your risk of stroke from increasing. Next slide. And then we've got lifestyle changes. So that's the medical management, and then there are things you can do in your everyday life. Tobacco use shoots your risk of stroke up high, along with so many other things. So quitting tobacco, reducing alcohol intake, and excessive alcohol also increases the risk of stroke. Maintaining a healthy weight, staying active, eating healthy, all the things that doctors have always said to do to be healthy, right? It feels cliche because it's true. These are really important things to do. Okay, next slide. So what happens when someone has a stroke? So as soon as you get to the hospital, the doctor is going to do a full assessment. They're going to see what your history is, because if you've had a prior stroke, that's important to know. If you have heart problems, if you have diabetes, that's all important to know for their assessment and treatment. They're going to do certain blood tests. They're likely going to do some sort of brain imaging, a CT scan or an MRI, where they can see the damage to the brain. They can see the type of stroke. They can see a blood clot versus a brain bleed. Okay, next slide. So the American Heart Association has created this Life's Essential 8. These are 8 things that are super, super important for us to do to reduce our risk of all sorts of health conditions. We talked about some of these already. Eating better. And what does eating better mean, right? People say that all the time. And it's hard to do, especially in Texas, when we have red meat all the time or fried foods. But at least limiting the amount of red meat, fried foods, fatty foods that we eat, and replacing that with lean meats, turkey and chicken, really increasing vegetables, fruits, whole grains versus processed breads and grains. The second one, be more active. So exercise does not have to be running a 5K every other day or lifting 50 or 75 pounds. Exercise looks different for everybody. Exercise can be done seated in a chair. I like to say movement more than exercise is important, especially as we age. Getting your heart rate up a little bit, getting arms and legs moving, building strength in your core. Not only does that reduce your risk of stroke, it also keeps your body healthier and stronger so that you're able to better stay upright instead of maybe having a fall and then end up in our hospital, which we see a lot of falls. Patients break a hip from having a fall. We talked about quitting tobacco. Next slide. Getting healthy sleep. I think sleep is one of the most underrated prescriptions that we can do to increase our health. This recommends 7 to 9 hours of sleep each night. Every time that you go to sleep, it's kind of like a cleaning out of your brain from that day. It helps to solidify memories of things that you encountered or learned, and it kind of just helps clean stuff out so the next day you're ready to do it all again. So sleep is very important. Talked about managing weight and cholesterol, and we'll talk more about that with these handouts. Okay, next slide. Blood sugar. We know that everything that you eat turns to glucose, to sugar in the blood, whether that is a piece of candy or a piece of fruit or a piece of meat. Everything turns into glucose. And so making sure that blood sugar is at a healthy level is important. And then blood pressure, and we'll talk more about that. Okay, next slide. So one of the things that we see a lot in the hospital, patients, maybe feel like they're healthy, they're active, they're eating well, but maybe they have diabetes or maybe they have a heart problem that they should be taking medication for, and they have a stroke. And then they come to our hospital and we say, what happened? Why, you have atrial fibrillation and you have this heart medicine. How are you taking this heart medicine? They say, I only took it every so often. Or, I forget to take that medicine. So they may have been doing everything kind of else right, but if you don't take the medicines that you're prescribed as prescribed, then it's almost like you're not taking them sometimes. And so taking them consistently and as directed. As directed means, in the morning with food. Don't drink alcohol with, following all the instructions on the pill bottles. Reducing stress, easier said than done, but finding ways to that work for you, things that you enjoy that can kind of help calm your system, because stress is also related to an increased risk of stroke. And I know in this modern age that's very difficult, but that is an important thing, and I think a worthwhile thing for more than just reducing risk of stroke, but just for your overall mental health as well. And then having regular medical checkups. Like I said earlier, if you keep a log of your blood pressures, you can bring that to your physician, and they can help manage any issues that you're having. And even if you don't do that, it's still important to go to the doctor every year, every 6 months, however often they want you to go, so that they can keep track of things, because they do check things that maybe you're not aware of. So making sure that you keep up with your appointments. Okay, next slides. All right, I have a few questions. Just a raise of hand. You can go to the next one. Raise your hand if you know someone who has had a stroke. Yeah, that's at least half, if not more. Yeah. So this is a very prevalent disease, and like it said earlier, it's also very preventable. Okay, next slide. All right, we'll see how good y'all were listening. What were some of the signs of a stroke? Face drooping, speech changing, arm weakness. Yep, speech. Some of the less common ones, balance changes, confusion, vision changes. Good. Okay, next slide. Why is timing so important when responding and treating a stroke? Yeah, and getting treatment early means that you are very likely going to have fewer symptoms, fewer deficits, and your recovery will be easier. Okay, next slide. All right, what are those medical conditions that can increase the risk of stroke and that we should be treating? Hypertension, diabetes, AFib, cholesterol. Good, yep. Okay, next slide. Last one. What types of small changes can you implement in your daily life to reduce your risk of stroke? And this might be different for everybody. Some of you may be really active, and so the exercise part or the movement part is not much of a factor, but maybe it's eating, or maybe it's really doubling down on making sure you're taking your medicines correctly. Does anybody want to share something that they feel that they can implement? Don't eat the donut you just finished. Or at least in moderation, right? Anybody else? Sleep. Yeah. Good deal. Exercising. Yep. Okay. I'm going to pass out, we'll talk about cholesterol first. Taylor, would you help pass these out? Here, you can take one and kind of pass it back. Take one and pass it back. I think they'll make their way. Actually, I need one too. Thank you. Here you go. Okay, so when we're thinking about cholesterol, cholesterol comes from two places. The food that you eat, and also your body produces cholesterol naturally as well. Cholesterol is found in foods from animals, so like vegetables don't have cholesterol. Meat, cheese, eggs, those do. There are two types of cholesterol. You're probably familiar with the HDL and the LDL. The HDL is the good cholesterol. When I think about it, H high, you want the good cholesterol to be higher. And the bad LDL, or the bad cholesterol is LDL, which you want it to be low. So the HDL, the good cholesterol, actually works to prevent the LDL from sticking to your artery walls. When cholesterol sticks to the artery walls, then that means that a clot can form easily. It also can kind of put pressure on those artery walls, making them weaker. Some of the things, you can see a little equation there for identifying your total cholesterol level. On the right side, you see the tips for success to reduce your levels of cholesterol. We've talked about all of these, but this is a handout for you to take home, so you can have those there. Are there any questions about cholesterol? Okay, and then I've got one more handout on blood pressure. Thank you. And this is the one that I really like to kind of harp on, for lack of better words. It's hard to keep track of your cholesterol unless you're regularly getting your labs drawn. It's easy to keep track of your blood pressure. Most insurances will pay for you to have a blood pressure cuff. They're also not that expensive at the pharmacy. But having an at-home blood pressure cuff is something that I really, really suggest that you do, and keep a log of your blood pressures regularly. So there's two numbers in a blood pressure reading. The top number measures the pressure in the arteries when the heart beats, and the bottom number measures the pressure in the arteries when the heart is resting in between beats. So you can see the chart there for blood pressures. Like we said earlier, 120/80 is considered healthy. And generally you want a lower blood pressure than a higher blood pressure. You can see when you start to get into the 120s, 130s, 140s, over 80, 90, even 100, that's where we start to get worried about your blood pressure and about an increased risk for stroke, among other things. Again, on the right side, you can see some of the same things that they recommend to manage blood pressure. Some people have a genetic disposition to having higher blood pressure or lower blood pressure. And you can't really do anything about that except take medicine for it and do your best with these lifestyle changes. And the same with cholesterol. Some people's bodies just make more cholesterol or have a harder time, managing it. But all the more reason to take the medications as appropriate, because regardless of if it's genetic or not, it still increases your risk for stroke. Okay? All right. Any questions about blood pressure? Okay. I also wanted to talk about, we have at our hospital, we have a stroke support group. It meets the last Thursday of every month. There's some flyers back there on that table. So if you know someone who's had a stroke and feel like they might benefit from a stroke support group, patients and their families or caregivers are welcome. Then there are flyers back there. We've been having this support group for the last year, and it's been going really well. We are the only in-person support group in San Angelo and surrounding areas. There used to be another one before COVID, but that got shut down with COVID. And the last thing that I want to talk about is May 3rd, we're going to have a stroke awareness walk at our hospital. It's our second annual. So at our hospital, we're going to have vendors and things for kids and games and bingo. And then we'll also do a 1-mile walk just to stay active and get the word out on stroke prevention and things to do to be healthy and reduce your risk. We don't have the flyers made yet, but once we do, I'll make sure that this group gets them. And we'd love to have you bring your families, bring grandkids, because there'll be a lot of fun things for the kids too. And you don't have to walk either. If you don't feel like you can do a mile walk, you don't have to do the walk, but we'd love to see you there. That's all I have. All right. Taylor's going to come talk about our hospital.
Hi, everyone. My name is Taylor Newberry. I am a liaison with Encompass Inpatient Rehab Hospital. I'm really excited to meet with you all today to discuss the services that we provide for patients who may be recovering from a stroke. At Inpatient Rehab, we function like a hospital, but we specialize in providing intensive therapy services for our patients. All of our patients receive, at minimum, 3 direct visits from their admitting physician per week to manage any acute or chronic health conditions that they may have. For patients recovering from a stroke, that often looks like continued monitoring of their neurological status, as well as managing for risk factors for stroke, such as hypertension or heart disease. We also have 24/7 nursing staff on site. A lot of our nurses are certified in rehabilitation specifically. So not only are they there to meet our patients' medical needs, but they also work with our patients on improving their independence with the self-management of their disease process so that we can maximize their independence at discharge and reduce their risk of getting readmitted to the hospital. And then lastly, we do provide intensive therapy services for our patients. All of our patients receive 3 hours of therapy per day, 5 days per week. We do provide physical, occupational, and speech therapy services. Physical therapy will work with our patients on restoring their mobility, such as getting in and out of bed, getting in and out of a chair, ambulating, while occupational therapy will work with our patients on improving their independence with their self-care, things like bathing, dressing, toileting, or even higher level tasks such as household management or meal preparation. We also provide speech therapy on site. Our speech therapists work with our patients on improving their cognition, as well as their swallowing if they have swallowing deficits. They will also work with our patients on any communication deficits that they may have, improving their independence with expression and comprehension. We do provide some advanced technologies over at Encompass Rehab so that we can work to remediate these neurological deficits. I'm going to go over some of these technologies with you today. If you look at the front of your pamphlet, this technology that this patient is using is called the BITS. A lot of our patients who may be recovering from a stroke may have vision deficits. So in particular, this woman is working on visual scanning. So she's scanning the screen, and she's having to find objects on the screen and touch those objects, which is helping reintegrate her vision and her coordination. If you open the pamphlet on the inside, you will see a patient who is in what we call our vector. Our vector is in our gym. It's a large track on the ceiling of our gym. With this piece of technology, we can bring the harness down and support the patient's body weight so that we can get them back on their feet while working on sequencing steps required during ambulation. We also provide several neuromuscular re-education electrical stimulation units. As we know, many patients with a stroke may have hemiparesis on one side of their body where that side is paralyzed. We will place a unit on the patient's muscles, and it sends an electrical stimulation to make that muscle contract so that we can work on strengthening those muscles again. We also have a vehicle simulator. Mobility can be a big issue for patients who are recovering from a stroke. So we will work with the patients on increasing their independence with getting in and out of their vehicle. We try to simulate our patients' home environment as much as possible during all of their therapies, just to help improve their carryover once they go home. So we can raise the height or lower the height of our vehicle simulator to simulate the height of their actual vehicle. And then lastly, we also have the BERT. The BERT is a robotic arm. Our patients who may have hemiparesis on one side can place their arm on the robot. There's an interactive screen in front of them while they initiate the movement for doing a task such as folding towels. If they can't complete that movement, the BERT will then activate to help complete the movement required for that task. Again, working on coordination and strengthening. Our hospital is certified in stroke rehabilitation by the Joint Commission. In order to be certified, we did have to go through a very rigorous evaluation process. And I'm happy to say that we just went through recertification and were granted our certification again. We do follow several quality indicators to maintain that certification, just to ensure that all of our patients are meeting the progress that they need to have in order to have a good recovery. And we do strive to set the standard for stroke rehabilitation. The American Heart Association and the American Stroke Association recommend that patients who are recovering from an acute stroke rehabilitate at an inpatient rehabilitation facility where they will receive intensive therapy services, again, and increased physician oversight. As part of our stroke rehabilitation program, we can provide services for patients who may not only be having an acute stroke, but a chronic stroke as well. Sometimes we have patients who maybe they had a stroke 2 years ago, but then they came down with an acute illness or an exacerbation of a chronic illness that caused an exacerbation of their neurological deficits. We can help those patients as well to get them back to the level that they were functioning before their illness. As Magdalene said, we also offer a monthly stroke support group that's open to the community. This is on the last Thursday of every month between 5 and 6. Again, it is open to the community, so if you or a loved one has had a stroke and would like to join our support group, we would love to have you. This brings me to kind of referral to admissions process. If you or a loved one finds that you're in need of inpatient rehabilitation, I have provided you each with a business card. If you are in need of services, or if you just have questions about the services that we have to offer, if you'd like to come take a tour, please let me know. I would be happy to visit with you more and assist where we can. But thank you all for having us out today. Again, if you have any questions, I will be here. I'm happy to visit with you, and let me know if I can do anything for you today. Thank you. Yes, sir.
What sort of coverage does Medicare provide for stroke rehab?
So for traditional Medicare will cover 80% of the cost. Patients who have a supplement, that supplement will cover the remaining 20%. Our typical length of stay is about 7 to 10 days or 10 to 14 days. That's not set in stone, that's just an average. So it can always change based on the patient's progress with us. Again, we can shorten that if they're progressing quicker than anticipated, or we can lengthen it a little bit if they're needing more time to recover. Our number one goal is always for our patients to discharge home as independently and safely as possible. That's really what we strive to do. And again, that's why we do try to simulate the patient's home environment at Encompass as much as possible, so that upon discharge, they have all the tools that they need to be successful. Yes, sir. No, sir. We are strictly an inpatient rehabilitation facility at this time. We only offer inpatient services. Now, we do have case management on site. So, say patients come to get their recovery started with us. Should they need home health or outpatient therapy services upon discharge, our case management staff will help ensure that that is set up for the patient. Again, we want our patients to be as successful as possible upon discharge, so we do provide case management to ensure that that happens. All good questions. Does anyone else have a question? Yes, sir. No, sir. We do not require a physician's order. We can direct admit from home. So, say you've been to the hospital and you were discharged home, and upon discharging home, you're realizing that you're having more difficulty than anticipated managing your medical condition, or you're noticing that you're having a decline in function. Things like decreased balance, endurance, strength, falls, inability to care for self. At that point, you could contact our office directly. We would come out to your home and complete a bedside evaluation with you, get all of your information, make sure that you qualify for services. At that point, again, we can admit from home. So patients don't have to go through the ER or through the hospital to get to us. Any other questions? That was a great question. Okay. Well, yes, I'm really glad you asked that. Yes, patients don't have to go through the ER, through the hospital to get to us. We don't require a 3 midnight acute care stay to qualify for admission like a skilled nursing facility may. Again, if you or a loved one are in need of inpatient rehab, I encourage you to contact me, contact our office directly, and we will ensure that we visit with you to make sure your needs are met. Okay. Alrighty. Well, again, thank y'all so much for having us out. It's been a pleasure being here with you guys today. If y'all need anything at all, let me know. I'm happy to help.